There are multiple ways to perform patient assessments. In this video, the instructor is highlighting the important parts of a basic patient assessment.
Scene size up. So as you're approaching a scene, before you get there, you want to start looking at what's going on. So are we in the middle of a trail? Do we need to stop, put our skis in a cross to mark the trail? So we create a blockade. Or if we're in a park below a feature, do you want to get assistance from a civilian or one of the mountain hosts to stand on top of the jump to protect you? These are all things you want to make sure you want to keep yourself safe before you approach the scene. Next thing you want to do, be aside, put on your gloves. As you're walking up to the possible patient, you want to look at their position. Are they sitting up? Are they laying down? Are they conscious? Are they unconscious? Take a primary assessment and then call it down the base of what you may need, what kind of assistance you want immediately, or possibly to stand by at Top Shack for later. Okay, now I have scene size up. Now I'm going to make contact with the patient. How you doing? I'm Chris. I'm with the Bear Creek Ski Patrol.
Hi, I'm Sasha, and my shoulder really hurts.
Okay, do you mind if I take a look at it?
Not at all.
Okay, so number one, I've gotten down on her level, so I'm a little more personal. I have gotten permission to treat, so now I'm going to take a look at her. So she mentioned it is her shoulder. So I'm going to start by just palpating. What am I looking for? Pain, crepitus, deformities. So I'm starting here in the back on the scapula, come across the clavicle, which is very common. A lot of times right in the middle third is where you will feel the fracture if there is one. Palpate glenohumeral joint, make sure the joint is intact. Come down to humerus a little bit. Also, since I've been speaking with her, we've already established ABCs. She has an airway and she's breathing, so that's all checked off. Don't be afraid to take off a glove. You may or may not get good circulation if they're cold, but you just say squeeze. So now circulation, CMS, circulation, muscle strength, and sensation. Make sure she doesn't have any numbness or tingling. Okay, and then next thing I might do is ask her about her fall, anything else that may be bothering her, and move on to the full body secondary assessment. Okay, so while you're waiting for transportation, you may be able to you may start your secondary assessment, or you can wait till you're down in the patrol room to do your fully involved secondary assessment. It's a lot easier to do it in the patrol room, considering the elements. Then we can take off their jackets, maybe even their snow pants, and better visualize any injuries and palpate better. Plus, it's a little warmer. So we start with head to toe. We can also take a quick look at the eyes, pupil response. We can look for any discharge from the nose or from the ears. The full palpation, we can start right at the top. Looking for any type of deformities, looking for anything painful. Work along the facial bones and the jaw. Work our way down the neck. We'll go right on down the spine. And be careful not to jump around too much and go over an injury, so you want to go inch by inch. Check everything. You want to check, you can check both arms at once. I'll just do one at a time here so you can see better. So you squeeze right on down. Go ahead and squeeze my hand. Good. Go ahead and hold up. Go on, squeeze. Now push back out. Good. We get along the chest. We can start with the clavicle. Going down the chest, you want to be careful. So go down the edge of your hand, palpating. Okay, so now as we move down into the torso, we'll look at the abdomen in 4 quadrants. Don't be afraid to push hard here. Pelvis, you want to give it a good squeeze. You can also give it a little cross and a little push there. Now we'll go down each leg. Give it a nice hold around the circumference, nice squeeze all the way down. Pull your toe up to your face. Good, push down. And we'll go across, and we would do the other leg also. And we'd also look for some sensations. I feel the same on both sides.
Yes, it does.
And there we go.